What are the signs of labor at 37 weeks pregnant?
The back pains that don't go away.
I've heard of women thinking they had really bad back spasms and found out they were really in labor.
The hard part is that due to the heavy load you are carrying in front, you tend to get bad back pains and are at risk of straining things.
So how can I tell the difference between labor and mere back pains?
First, labor pains will center in the lower back, so back pains in the upper back are just back pains,
albeit bad.
Second, labor pains will include pressure in the pelvis, stomach pains and other pains in addition to the lower back pains.
So if I have back pains and stomach pains, I'm in labor.
You can have something else causing it, such as stomach pain and pressure from very bad constipation.
I know what constipation causes, and if it clears up when I have a high-fiber meal, then it isn't labor.
If you are in early labor, the muscle contractions of the uterus can cause diarrhea.
Then I need to know how to tell the difference between a stomach bug and a baby about to come out.
A stomach bug will cause severe diarrhea that won't stop after a few hours, while when you're in labor, the diarrhea stops after an hour or two while the contractions get worse.
So if the muscle pains continue though the digestive symptoms stop, I'm in labor?
That's the most likely answer, yes. And if you have the muscle contractions in the back but have some nausea and throw up a few times, but the muscle pains continue after you stop throwing up, it is likely labor.
I didn't think labor symptoms could be mistaken for so many other things.
If you've had a urinary tract infection lately.
I'm a pregnant woman in my 3rd trimester. That's almost expected.
If the urinary tract infection worsens and turns into a bladder infection, you could feel constant bladder pressure in the pelvis and pain as the bladder tenses against the infection.
I'd also still have that burning feeling when peeing and maybe even blood in the urine.
If you have bleeding from the vaginal area, with or without pressure or pain, you need to go to the hospital in case it is labor or something else.
What else could it be?
A tissue tear that needs to be addressed.
Glad to know we've already pre-programmed the hospital's address into the navigation system.
If your water breaks, that's a sure sign you need to get to the hospital.
I've heard of someone's water breaking when they weren't in labor.
Because the amniotic sac protects the baby, if that breaks, you want to get the baby out anyway.
I'm due anyway, thereabouts.
One sign of early labor is that the baby feels like the baby is going to fall out.
I already feel so top-heavy I feel like I'm going to tip over.
If it feels like the baby is going to fall out at any moment, the baby's head has likely moved into the pelvis as a precursor to labor.